Terrific, right on time. I'm going to open it up to the floor now because I think we want to get as much input as we can from members of the forum, reacting to things you heard that particularly resonated for you, that you want to endorse or elaborate on, or other ideas that you haven't heard about. And so we can just keep track of these and then sort of try to pull it together in the last 10 minutes or so. So can I see those who would like to talk? Kathy, you want to go ahead? You want to start? Yeah.
I don't know how I always push. I guess I'm up front, so I push to the front. So thank you. This has been very enlightening, and I echo Brenda's comments, thanking the organizing committee and the forum for doing such a great job with this particular workshop. So there were a couple of things that resonated with me, and I'll make my comments brief. So one is this idea that we've talked about, the horizontal versus the vertical, and going back to the new sustainability goals that will be coming out. And I think probably mostly everyone in this room knows I kind of complained that there wasn't a specific goal that had to do with health system strengthening. So I would like to, for us to think about, what I've heard described as the diagonal, and working in that diagonal space, and specifically trying to identify what opportunities are in that diagonal space specifically that will lend themselves to benefiting greatly from public-private partnerships. And that kind of segues to my next comment, which is a little bit harebrained, but I'm just going to throw this out there because I have been so impressed listening to all the examples of public-private partnerships from our industry partners, our government partners, the NGOs, and it kind of makes my head spin a little bit. The size of them, the scope of them, the impact, it's incredibly impressive. And to try to understand where those are all fitting and the gaps that they're filling and where they might be overlapping or they might not be overlapping, or how existing infrastructure, say for polio that you talked about, Ambassador Lang, could be evolved to apply to health systems, or from PEPFAR to evolve. So it seems like I'm going to ask that we bring IBM into the forum, and they bring Watson with them. But I'm serious, though. That's the real funny part of this. Because these are the kinds of problems that Watson can actually solve. And to think about, when you have, you're doing a network analysis, essentially, of global health. It's crazy. None of us can wrap our heads around it. There are probably, I know, many people in this room that have wrapped their heads around it a lot more than I have. But to really understand, what do we need? Yes, health system strengthening, but we're not going to build a health system like, you don't put it up like an inflatable castle. It's component by component by component. So I just think that if we really had a more data-driven idea of where we need to put our resources with respect to where they are now, or where they could be moved to, that would be beneficial. Thank you.
Ideas, thoughts about this? Francis, let me ask you to put you on the spot since we have you here.
Certainly, it's been an exciting 2 days. I have enjoyed every moment of it. And Sir George, I'm very sorry I missed the beginning of your talk, but I know whom to blame for it. But I think I heard most of it. Now, we should probably have had a background paper on the topic, and that is what Sir George has asked for.
Short one, but I think that I've heard people would
Yeah. Yeah, so let's do it as part maybe of the summary of this work. Mm-hmm. Then the other point I would like to make from what we've had 2 days and this afternoon is Wendy Taylor. You are asking us to learn more about partnerships, how they can work more together, what. Now, from my own experience in global health, we have many partnerships that we've put together to solve global problems, which I believe have worked very well. The Global Stop TB Partnership, and through that we were able to get drug donations, which are made available to the so-called 22 priority countries. And then we've had the Global Fund to fight TB, HIV. It has really worked very well as an African, what sort of beneficiary of this. It has worked very well. I contributed to the founding and running of the Global Health Workforce Alliance. That's an intractable, very difficult global problem to solve. And we got a partnership which is now trying to bring the stakeholders together. And so on and so on. There are many of these. GAIN, I think someone talked about GAIN yesterday. There are many of these. What I see is missing from this, there's GATES. GATES shows up quite a lot in virtually all of them, but it is GATES. What about the others? I know the others, there are those who have come forward with pharmaceuticals to contribute to this, like Coatem in the Global Fund, and then the TB drugs and so on. But one would have liked to hear more about the IBMs and the General Electrics and so on. I don't see them in these global partnerships. Maybe they are there in some way, but I would like to see them also there. So let's look at those partnerships. Let's see what has worked well for them and so on. And then we also have the issue of governance. I think it has come up quite a lot. Governance of these partnerships themselves, but also when we are, I think Kathy Taylor, that is the health systems, governance of global health is a big challenge, because even those agencies which we put in place, they also end up being managed by Homo sapiens, people like us, with our weaknesses and our strengths and so on. And we have challenges with all of them. How can we make sure that the right people are getting the right jobs in, like the UN system, Ambassador Lang? You know, I think we held a conversation in the dinner, the pre-meeting dinner about Ebola and governance of the UN. So that also is something which maybe with the private for-profit group coming in, we'll see more. And when we talk about universal health coverage, governance is really what we are talking about. All those studies, the social determinants of health commission, they come back and tell you governance is very important. Then you also find that governance, not even health governance, but just governance of society, ordinary governance of society, is perhaps what we should be focusing on more. If in those West African countries, there were structures on the ground which were watching each and every home, who is falling sick, who is expecting a baby, who is, died, we would have been able to pick that epidemic earlier, even to control it quicker. So just governance of society, certainly for Africa, this is an issue, because governments, sometimes they just end up there, they are not down there. And when they are not down there, things go wrong there, law and order and so on, and people can't go about their normal business. So somewhere, I think the UN system, we should find a way of returning or prioritizing just ordinary governance as a tool for solving so many of our social and economic problems. And Ebola, I've written a piece on this. I don't know how you will get it. It will get published, or it has already been published in a journal called Africa Health. I do a blog there every 2 months. And it's also on our website, the Chest website, on how governance could contribute to controlling Ebola and other diseases. So I would like to stop there. There are so many things to say, but in summary, we already have experience with quite a number of global partnerships and also national partnerships. Let's just evaluate those, let's study those, and look for where the private sector, the ones we are thinking about in this room, how they can also be brought in. And I think if we start doing that and working better with them, maybe next time the World Health Assembly meets, it will adopt this. And also, if we may be using this, we all come from countries, the way the UN system works at WHA, it is countries who are going to support or not support this. If you ask us to go around to our countries to support this, because we have got good reasons which meet all those things, then perhaps we can pass this. And I think we should get that resolution passed as a global public good. I think we should push for it. And I think I should stop there. If I have something very hot coming back later, I will ask for the floor. But I think we are on the right track, and we should document this work, what has happened these 2 days, and do also a study to bring things together and a detailed analysis of how things work, and use this to advocate and create the climate of opinion that will make PPPs part of normal governance. Is it of the modern state and the modern global community, as Sir George said. I will stop there.
Okay, thank you. Other comments? Yes, Kate Bond?
Thanks,
Catherine.
and I also want to thank the panel for what was an exceptional synthesis by each of you that complemented each other very well. And also Kathy's point, I think, is very well taken. I just want to say that during the course of the last 2 days, there have been at least a half a dozen times where I've heard something or learned something that I have then fed back to my team to think about in the context of the partnerships that we're involved in. And I think that there's some real-time benefit, practical benefit to this forum. And I have to say it's in that spirit that I confess that I am the one who kept Francis from being here on time for the first few minutes of Sir George's talk, because I just couldn't let the opportunity go. But I really do see there is immense collective wisdom in this group, and not only the wisdom of experience, but also some very practical tools, sort of analytical frameworks, et cetera. So I guess there's a question or a suggestion to the forum to really think about how to make this a living forum, a community of practice sort of notion that allows this learning as it goes forward to actually feed into the kinds of partnerships that we're all engaged in. So as I believe Brenda said, we can at least increase the likelihood that they'll be successful.
Yeah. It's a really good idea, because one of the things we've been struggling with the staff level is, and that's why I put the different, sort of tools on the table, is sort of maintaining momentum and forward progress between meetings. Because if we have 2 workshops a year, or some people are involved in a particular collaborative or working group, it doesn't create the kind of, community of practice or learning collaborative that you're talking about. And I think it's an interesting question, challenge for us to sort of think about this. Patrick, you have your hand up, and then if there's nobody else, I'll try to sort of give us the last. Oh, okay, Carol as a visitor. Yeah, absolutely. Anybody else? Okay. I'm sorry, who else? Oh, okay. All right. Very, very briefly then.
Okay.
Patrick, Carol, and Louise.
I just wanted to ask Brenda to expand a little bit on the trust issue. I think the pharmaceutical companies are a unique collection of interests. organizations like MSF are kind of a unique collection of interests. I suspect they trust you as an individual. I mean, who wouldn't? You're wonderful. But I suspect you have a certain amount of baggage, you know, because of the industry you're associated with. You know, do you see these trust issues as cropping up in partnerships between different kinds of entities, not just pharma and an organization like MSF, or for that matter, I suspect there's some people who don't trust the United States in general. They just automatically assume certain things, and that gets in the way. I'm wondering if this can be taken on at a larger level, and is it just in the psychological dimension, or is it in the philosophical dimension that it needs to be addressed? And are there ways of dealing with these issues through kind of neutral third parties? To some extent, that's what we try to do with this forum, is provide a space where people who might not be able to communicate so well in a bilateral way can communicate in a more neutral platform.
So just a couple of comments. So I do think that as individuals get to know one another as individuals, those barriers break down. And I do think that a lot of times it's the organizational bias. And, you know, and frankly, companies, you know, healthcare companies, other organizations have done things that cause that distrust. So, you know, no one's innocent here. I do think, though, that it would be nice to see us forgive one another for past transgressions and move forward. And I think that's where we get stuck. You know, many times we hear about something that the industry or a particular company did 20 years ago, and we're thinking, can we get past that? I mean, we've acknowledged that maybe that wasn't the smartest thing we ever did. So I do think there's a little bit of that reluctance to kind of let go. In response to your question about, is this happening with other organizations, I don't know. I mean, I suspect that trust is difficult for organizations, especially when you operate differently. Maybe your overall objective is different, whether it's profit-making versus nonprofit. So I think it's something that's just inherent. The one thing, just to be fair, that I will say about MSF, interestingly, MSF is a very important partner in the Mectizan donation program. And they have helped us to deliver Mectizan in some of the greatest areas of conflict in Africa. So sometimes the distrust isn't even consistent. But I think, you know, I just think it's this inherent thing that we need to put on the table. And for me, I think the most frustrating thing is I'm not really sure what's behind it all the time, because I don't think people, you know, Kathy and I were talking last night about people feeling the need to be politically correct and polite. And sometimes you want to say to somebody, okay, you don't need to be polite. What is your issue? And let's just deal with it. So I think there's a little bit more of that honesty that has to come forward. But I don't have any great insights as to, you know, who, what, where, and how can we overcome it, unfortunately.
One of the issues that in the context of what Kate's raised, the possibility of a sort of, you know, community of practice or learning community implies, at least for certain conversations, sort of developing an ability to have them on some of these tougher issues. And it's an important thing to think about here. Yeah, Carol?
I briefly wanted to reinforce the issue of not just Watson, but big data in general, and the issue between not the have and the have-nots, but the know and the know-nots. And I think many people in the partnerships will simply not have the access to data collection, data information, collation, analysis that you would require. And particularly, of course, the nonprofit sector doesn't have the resources to get there. So it's not just IBM, but it would be GE, it would be the pharmaceutical industry, it would be UPS. I mean, they have a substantive amount of information that could be of use to any partnership. So that maybe, I don't know what the role of a panel like this or a forum would be, but to discuss specifically that part and how data sharing and information sharing between those who have access and those who not for common good would be a useful topic for a future forum.
Louise?
Yes, quickly. Wendy, you mentioned that the leadership, Raj and other leadership at USAID encourages public-private partnerships. So should we assume that there's some structure or governance that's in place? Or is the staff left to figure it out and find partners? And can you tell us about that? And John, quickly with WHO. If WHO had a leadership structure and discretionary funds that were more appropriate to their scope and mission, do you think then that list of principles that they had to, comply with about private partners would be a little bit more authentic? And that if you didn't have one or two donors that covered a large percent of the budget of WHO, that we would trust that more? So very quickly, and I'm sure there are no easy answers, but thank you.
So I'll just give you the quick answer is yes, and I think actually in an increasing way, sort of we have sort of different mechanisms. So we have the Global Development Alliance mechanism, which was put in place not in this administration, but a prior administration, which is a tool that we use to be able to establish partnerships and allows. We aren't always the easiest organization to be able to well, we have a difficult job getting our money out there. Partnerships are one of our mechanisms where you can actually let the money flow more easily. We can form partnerships a lot more easily than we can do some of our other contracting structures. But we have that. We have even a new tool we put in place just this year. It's called the Development Innovation Accelerator. So under GDAs, any company can come and propose something to us. The Development Innovation Accelerator actually is a mechanism which is even more flexible and open and allows for co-collaboration. And so we are going to increasingly use that tool as a way to signal areas where we're interested in development ideas, and people can come in and seek ways to work with us, and we can very openly work with you, kind of co-collaborate and design projects together. So those are two new ways. And we're also doing better at relationship managers and trying to create a sort of single place to come through the agency, because otherwise it's a little bit of a wild west to try to figure out where to enter and how to navigate. So we're working on that.
There's been a various multifaceted effort for WHO governance reform. One element of that is their framework of engagement with the non-state actors that I discussed earlier. A separate element is actually approval of the budget, because in the past, astoundingly, member states didn't approve most of the budget of WHO because it came in through voluntary contributions, and whoever made the contribution could, in a sense, dictate how the money was spent and where it should be spent, unless WHO just chose not to accept it. That is now changed under the new procedures that they're putting in place. There's going to be a lot more restriction on where the Director General can spend money outside of accepted priorities, and it is like the limits, I think, are anything over 5% change has to be approved by the member states, with polio being an exception, because sometimes that takes in more, needs more resources than had been planned. But I really see that as a separate issue from the one of the engagement with non-state actors. That some countries are skeptical of profit-making corporations, they're skeptical of philanthropic foundations, et cetera. It's more of a sovereignty issue for them, I think, that they want to be able to ensure that WHO isn't driven by these outside forces outside of the member states. So I think of them as separate. And just one final point on this. After going through this major effort on WHO reform, I wouldn't be surprised if Ebola results in a new look at this, because clearly one of the things they need to beef up is their emergency response capabilities, and the relationship with their regional offices comes into play, and all kinds of issues that the WHO and AFRO response to Ebola has brought to the fore.
Okay, let me just take the prerogative of the chair, and I'm gonna mention a few sort of two, three, maybe three categories of things I've been hearing. This is really just for us to then think about, and then I'm going to give Sir George your last shot here as our sort of big picture guy. No, I didn't say that. So I'm hearing three. We've heard not just here, but we've heard three sort of immediate opportunities, I think, for this group if we were interested in trying to work on them. One of them is the role of public-private partnerships in the SDGs. I mean, there is a 9-month window of consultative processes, and as Francis mentioned, most of them will be at country level, but there will also be opportunities here, and there's always this great category of SDGs called, partnerships for development, which of course sat there under the MDG side, and now it's there again for SDG. So I think that's sitting there, and I'm just going to mention these. I don't know, I'm not going to do a reality test on what's possible, but I think there is a real opportunity there, a real-time opportunity. We heard about the Global Health Security Initiative earlier today from our colleague, and I think there was really a request, an invitation to help think through perhaps the role of the private sector as that develops. And we had talked with, is it Beth Cameron, I think? Yeah, after the session was over, and she was quite keen to continue a dialogue. So I think that's a real-time opportunity that, in a sense, meets the other idea of taking Ebola response and kind of morphing it into something that could be different long-term than it may have been. The other real-time issue, I think, is clearly this role of non-state actors with the UN, the intergovernmental structure. And we've heard that Ambassador Lang is part of that. Thomas Zeltner, who is one of the Swiss Academy representatives to the Inter-Academy panel, is also leading, actually, that consultative work group for his sins, I guess. I don't know. He's quite a wonderful international civil servant. But I think there are possibilities of looking at where that is and seeing if there's anything can be done. Don't know, but it's it's an immediate matter between now and May, maybe. I don't know, maybe even January. It's too soon, but that's another kind of issue. Then I heard, I think, Kate's idea of thinking about what would a community of practice look like, which builds on people's desire to have a real-time engagement and learning from each other to the degree that, and it may be around some of these issues like the difficult conversations, I mean, the trust issues or the sort of failures issues or others that we might work on those between meetings, and they may end up with something that could become a sort of built-in part of our face-to-face times together. And then the last area I wanted to mention is this area of mindset shift. And it came up repeatedly, and I think it came up, Wendy sort of mapped it a bit on the mindset shift of the U.S. government, and also talked about the mindset shift. We've talked about the mindset shifts and I think Brenda talked about this of the corporate sector around their engagement with partnerships. We also mentioned the, if you will, the development community, but I think we heard also early on from our African colleagues from the meeting that happened last week of a mindset shift within Africa. I think Francis was quite articulate about that in his talk, of people in low-income countries really wanting to take ownership of an agenda, and that links to this who's missing from the conversation. I think it speaks to who's missing from perhaps our conversation going forward, and we ought to think about that as well. But so it would be that issue of taking advantage of those, if maybe they're shifting, maybe if not tectonic plates, at least opportunities to think about what might that look like as an agenda to really try to see how those shifts could converge or align into something that could move a sort of global development, align a global development agenda with, or country development agenda and global perhaps with business interest. So those are just the things I wanted to put on the table. Francis, yeah, please, very quick word, we're over time.
Yes, the non-state actors and WHO, maybe Ambassador John Lang, you can see how we go forward with this. The experience of adopting the WHO code on the international recruitment of health workers. It happened exactly like this. One season, it was rejected. And then when it came back again, together with President Mary Robinson and the council, George was a member of that council on advisory policy on health worker migration, we convened delegates a week before the assembly in Madrid, and together with WHO technical staff, and we planned, or rather schemed, I think is a better word, on how to get the code passed, and it did pass. I wonder if there is a stream of work we can take forward from here on understanding or learning how we can get this WHO, the assembly to pass this, because I think it's very important.
Yeah. I think that we aren't as aware of in the U.S. is the power of the sort of dictates and statements of these international organizations, especially in low-income countries with fewer resources. So while it may seem, well, who cares if they get around to that, it's quite an important issue in terms of guiding ministries and others. So let me and I think the other decision point here really is this forum is, it's a discussion, it's a learning opportunity. Whether we want to become an action platform is another question that we have to sort of sort out ourselves. But the more people have information, I think we can act in real time as individuals or individual companies or organizations. So, Sir George, final word?
2 minutes. One, I like very much there are 5 things you put out. I would just suggest that in the role of PPP and SDGs, you might perhaps think of the health SDGs or the ones germane to health rather than all of the SDGs.
This is true. I wasn't thinking analytically.
Okay.
I wasn't thinking granularly. I was thinking generically.
No,
you're
no,
right,
but
you're right.
I agree with you.
Yep.
Second point, in terms of the role of non-state actors, again, referring to what Francis was saying, we must not underestimate the power of data to change the minds of people who are in power. And one of the things I think you mentioned is that data about how these non-state actors have performed and how they've contributed would be a useful exercise. Much of what is constrains us is the image and the distrust, the fear of these, rather than data about what has actually happened. I don't think Watson would help you. The reason why Watson wouldn't help, Watson needs a specific question, and it's very difficult to form a specific question that can be answered in this form. However, I do agree with you that in this space, what we call the diagonal space, in the sense to which categorical programs help to build health systems, yes, we do have examples of private-public partnerships that have worked in that space and can show results. The penultimate point is, this is my second last, my penultimate point is this: in terms of the changes, in terms of trust as well, much of what we see is because of the changes within the state. Yeah. When the government and state were coterminous and everything within the state was government, that was fine. The government did what it's like. But now we have the growth of the private sector, the growth of civil society, which in fact has arisen because of distrust with government. It is this growth of the state and the growth of the actors within the state that has created much of this. And to be concrete now, what one thinks needs is to get the opinion of much of civil society on these public-private partnerships. And that is something I think deliberately one might try to do. What is the opinion of civil society about the efficacy? And the last is this. I'm very enthusiastic of separating government from governance. Right. And many times we speak of government or governance when we mean government. And what I've always been taught is we should think of governance as those structures and processes that are necessary for the optimum function of the institution, the structures and procedures, not in terms of necessarily the hierarchical organization and the way in which orders are transmitted and executed, but those structures and processes. And I think if we adopt that role, that is something, in fact, analysis of the governance of many of the successful public-private partnerships would be an interesting exercise in itself, because they vary in governance. We all might find the extent to which certain forms of governance have led to optimal function of those institutions. But I think your 5 things are excellent, and I would hope that the forum decides to move on them.
I think this issue of data, where this group probably uniquely has data from their private sector experiences with partnerships that may not be available. It's a very interesting angle we ought to keep in mind. Yes, I'm having waved at me. I should have said this before. The yellow forms, which are evaluation forms, right, that people are supposed to fill out. I want to allow my co-chair, Clarion Johnson, and our other Uber hat to say a final word, and then we'll bless everyone and thank them for their fantastic contributions, most recently and over the last couple of days. Clarion?
Tremendous meeting. Meeting is adjourned.
Thank you.
I think we should thank our
He
chair.
says the easy part.